Hello, my name is Mike Coates, and I'm a clinical director in primary care, and I'm also the deputy clinical lead for realistic medicine. And my role is to educate and guide all colleagues in primary care and other allied health professions in the shared decision-making process. The aim of shared decision-making in realistic medicine is to make the person receiving care central in the process. As healthcare providers, we need to explore the holistic needs of the patient and define what matters most to them so that we can ensure the care provided addresses their ideas, concerns, and expectations. A goal of realistic medicine is to empower patients and their families. It facilitates a shift from the old adage of clinician knows best. The right care can be delivered at the right time in the right place by the right person. It facilitates an in-depth discussion around treatment options and their associated risks and benefits. There are 6 pillars of realistic medicine, and these are shared decision-making, personalized care, reduction of harm and waste, managing risk better, encouraging innovation, and reducing variation. Shared decision-making occurs where the healthcare provider and the patient work together, and just remember that shared decision-making is a process. What it isn't is simply providing a patient with options and leaving the choice to them. The 2 key players are the healthcare provider, who are the clinical experts, and the patient, who is the expert in the illness. And remember, illness and disease are different. Disease is the pathological process, and the illness is how the process affects that person. Shared decision-making isn't always appropriate, and in situations where there's an emergency, where treatment or intervention is not indicated, or the patient or individual lacks capacity, render the shared decision-making process inappropriate. In order to empower patients, we encourage them that during discussions with healthcare providers that they ask certain questions. Is this test really needed? What are the potential benefits or risks? Are there any possible side effects? Are there simpler, safer, or alternative treatment options? And what would happen if I did nothing? A slightly simpler version of this is BRAN, B-R-A-N. This provides a model for the process and ensures that essential facets are covered by the patient in entering the process. What are the benefits? What are the risks? Are there any alternatives? And what if I do nothing? Evidence shows that there are many benefits to the shared decision-making process. Decision regret is a situation where, for example, a decided upon treatment doesn't bring about the desired effect, or there may be complications of this. If a patient has been made fully aware of all the risk benefits and possible repercussions of the treatment, and they are aware of all the potential outcomes, decision regret is diminished. Risk is an essential part of the process, and it is important that we convey this to the patient. It's essential that we use plain language and be open about uncertainty. As we say, effective communication is essential. We need to establish a rapport with the patient. There needs to be active listening, language is appropriate and understandable, and there needs to be a structured approach. The DECIDE model is very useful in this respect. What we can do is define the decision that needs to be made, explain the situation to the patient. We consider what the available options are. We can invite their views. We can decide together. And then to round off the process, we can evaluate the decision that's been reached. There are a number of resources available for the shared decision-making process, and I would encourage you to review these. Thank you for your attention, and I hope this has been informative and helpful.